After about 15 years of working in corporate medicine, it really became clear to me that patients weren't getting the care they needed. They were feeling like they were being treated like a number. They weren't being heard. There wasn't relationships between them and their provider. They would leave an appointment really feeling like they were actually more confused about their bodies than when they walked in the door. They couldn't get access to care. They couldn't get in a timely fashion. So all of these things were building up, and as a provider, I felt frustrated for them. So I decided to take a leap, dream up, nurture, and kind of put the patient at the center of what I thought really phenomenal care could look like, and patients really resonated with what we were here to offer. So Nurture Women's Health and Fertility is a holistic, integrative women's health practice that focuses really on serving the needs of our community in fertility, hormonal wellness, and then the transition from perimenopause to menopause.
I think something that makes it so unique here is we have long patient visits. In other medical settings that I've been at, you are seeing a patient every 15, sometimes even 10 minutes. We have carved out the time to really get to know the human being in front of us, which I think helps kind of build that foundation of health and wellness. So then if medical interventions are necessary, which in a lot of cases they are, and I absolutely believe in Western medicine, but I think if we're doing that without remembering that underlying foundation of health, then these interventions are just not going to be as effective long term.
My favorite thing about pelvic PT is giving people hope for their symptoms when they came in and they really didn't have much hope. So a lot of times patients will come in and they'll say, I have constipation and I really don't know why I'm here. And then by the time we finish talking, they walk out very excited and very hopeful for symptoms that they didn't think they were going to get help for.
So the main challenges that I see with patients at Nurture include fertility, perimenopause and menopause, peri and postnatal struggles. Also, there's a lot of anxiety, depression, grief. And so when we think about providing, medical care like Dana provides, it's a physical aspect of someone's world, so that's their body. But we know that if someone is experiencing something like PCOS, of course they're going to feel like, why is this happening to me? Of course, they're going to feel feelings of maybe some guilt or maybe even failure. If you solely focus on just the physical aspects of what they're experiencing and leave out the emotions, then you're doing the patients a great disservice.
Women's healthcare is a vulnerable place to be. The hardest part is walking in the door here. When you walk in the door here at Nurture, you're going to see friendly faces that are welcoming. You're going to get answers. You're going to have a plan. And at the end of the day, you're going to have a team that surrounds you and supports you through a transformation into hormonal wellness, whether that's fertility, endometriosis, or menopause. At Nurture, I have the autonomy to practice healthcare with the patient at the center, at the focus. That is empowerment. And women deserve to feel empowered about their bodies, about their health care. And at the end of the day, that is what fuels the fire for me.